So good morning, everyone. My name's Mike Sapiro. I'm a psychologist and currently a fellow at the Boise VA Medical Center, where I'm specializing in rural health with an emphasis on PTSD and combat trauma. And before I served veterans for the last roughly 6 years, I worked with children around the world, developing programs and being present with kids who were suffering in different forms. And I was thinking about what I was presenting on. And I'm here as a clinician, not as a researcher. I'm here to give voice to those of us on the front line that utilize what you do in the lab with people who are suffering from a variety of disorders and dysfunctions, and I would say having a dirty lens, a dirty perspective. And so partly what we do as a clinician is take what you do in the lab and apply it on a daily basis with people who need the most help. So I'm here to talk about the impact of your work and to suggest a few ideas for where I'd like you to move as researchers in the future based on my experience working with people who are suffering. So that's what I'm doing here today. And so I was thinking about all the work I've done with kids, with veterans, with native populations, and I was thinking it's not really what I do that makes a difference. It's who I am and how I be when I'm making a difference. So the kids don't care what interventions I use. Veterans really don't care what interventions I use. What they do care about is how I am when I'm with them. And so this got me to thinking about the title of my presentation, which is Presence, Awareness, and Vulnerability. These are aspects of being that I would like you all to study in the future, because my belief is the way we are impacts the person we're with. In his brilliant commencement address to Maharishi University of Management, Jim Carrey in 2014 said, "Our effect on other people is the greatest currency that we have." And I take that to heart as a clinician. So every time I'm with someone in the room and their suffering is full bloom, I think about the impact that I have on their life. And so today I'm going to talk about presence, awareness, and vulnerability as the interpersonal aspects of intervention, meditation-based intervention. But I'm going to give you a little bit of a case study so that you can feel the impact that I'm speaking about. So you can imagine being in a room, let's say with a Vietnam veteran, 64 years old, has been carrying symptoms of PTSD for 46 years since he was in the jungle in Vietnam. 46 years of suffering from nightmares, anger, irritability, not having connections with people because of fear of vulnerability, fear of looking weak and expressing emotion. 46 years of living in a very small space of fear within inside the self. So this is someone I might be sitting with on a daily basis. And so from the work of Dr. Helene Wabe, who is one of the presenters here, we know that meditation and mindfulness, what it does is it helps regulate emotions, increase heart rate variability, it induces or invites parasympathetic arousal in the room, it impacts the immune system, it reduces cortisol output. So these are all things we know from science, that you in the room and future researchers help us actually understand the physiological benefits of meditation. That translates to helping people who are suffering reduce symptoms in the room. So a veteran or a person who's been through trauma is hyper-aroused and always looking and always hyper-vigilant, on guard against danger because they've been hurt. So deep breathing, slowed breathing, helps them regulate, not only emotionally, but physiologically. So we know this. It's great benefits. Science and meditation together have created great benefits for reducing suffering. But that's not it, though. That's not the end goal. And I say that because I'm sitting with someone who observes the physical difference in their body. I feel more relaxed. My mind, I'm starting to witness. I have present moment awareness. I'm witnessing how angry I am. And so when they think about interacting with their spouses or their family after having certain length and time in practicing meditation or mindfulness, they come to realize, and this is verbatim, You mean I don't have to be an asshole? I get this all the time. So I want you to stop and think for a moment what that means. It's a moment of self-discovery. I'm not these things in my head. I'm not my reactions to the world. This should sound pretty familiar to us who practice meditation for a lifetime. We go through this every time we sit on the cushion. Oh, I'm not my thoughts. I don't have to follow that. I'm not my way of interacting in the world. I can do something differently. So meditation so far as an intervention has brought us to this place with our patients and our clients where they're reflecting on the self as something other than the constructed, conditioned self. So we're here, we're right there, right where we need to be, and yet we need more. We need to go a little deeper, because here's what a veteran would say. I don't have to be a jerk. I can choose something different, but I don't know anything different. My whole self for 46 years has been this thing which I thought it was, and now it's not this thing. What is it? Who am I? Now what do we do? Right? That's what we do in our meditation practice. Who am I? Who am I? Who am I? Who am I? I lost the self. I gained the self. What's the self? We're comfortable in this realm, but how many people outside of the meditation experience are comfortable asking themselves that? It's a very scary question to ask yourself when you don't have support, or when you're alone, when you fall apart and you realize, I don't know who I am. So where we're not yet in the clinical realm is helping address that. So here's what I answer them. Because you see, I only have a short period of time. I don't have 20 years with my veterans or my patients. I might have 8 sessions. I might have 12 sessions. So what do I do in 8 to 12 sessions to get them to a point that not only symptoms are reduced and they're living their life of value, but they're starting to rediscover their self beneath the pain and beneath the suffering? I say this. I said, I'm not, and it's part of my vulgarity, but you know that's part of the population I work with, so I'm not gonna bullshit you, I say. You are the field in which all things arise and fall, and you are the wellspring from which warmth and peace and being arise. Now that can go 2 ways. Without a relationship, they don't come back. All right? They're like, are you from Berkeley? With a relationship, they laugh at me, and then curiosity arises, because there's trust and safety. There's trust and safety in the room to believe me, not only because of what I'm saying, because I'm emanating the peace I'm talking about, because I'm embodying presence with them. So not only am I saying you are this thing which is well beyond your experience, but I'm going to embody that for you, and together we're going to explore what it means to be those things which I just spoke about, the wellspring of being, the source of all things, form that arise and fall. But as we know from our own meditation practice, this is not an instant occurring phenomenon. It can be. We can have that instant experience of the field. But what it takes is an integration of the selves that Paul Mills talked about in his speech, in his presentation. It takes integrating all the aspects of ourself to see our wholeness, to see that we're already unbroken and we're whole. It takes integrating the darkness and the shadows and the joy and the light. And for many people, that integration is the struggle that they come to me for, they come to therapy for. So before I talk about how presence awareness and vulnerability actually can be studied, I'm going to go back and give you some context about where I'm coming from in my own life. And so you know why I came to these 3 things, presence, awareness, and vulnerability as a clinician. I am a 3rd-generation Holocaust survivor. My grandparents, Hungarian Jews, were in the camps in Auschwitz, and a lot of my family was killed in World War II. So we talked about, there was a talk yesterday that brought up a little bit of epigenetic, intergenerational transmission of trauma. I grew up in a very safe environment in Chicago, yet I was having nightmares, night terrors. I have startled responses, anger and irritability, all the signs and symptoms of PTSD I grew up with because my grandparents, rightly so, had that response to trauma, passed down to my mother, who's enduring and so resilient now, working on her own issues coming down from generations, and it came down to me. So in my teens, I used lots of self-medicating techniques to reduce my own anxiety and my terror that was seemingly unfounded, but now I know is coming through ancestors. And then I came into meditation in my late teens. And as I started to embody what meditation offers, in my late teens and early 20s, I realized what the benefit was of being present. I got a lot of dates, actually. We have some, seriously, who doesn't want someone to be present with them and exude a sense of presence? And I'm like, oh, this is amazing. If I just listen deeply and I'm present, girls want to hang out with me. This is totally true. We're not filming yet, right? No? No, we are filming. I love you, dear. This is way back in past. So once I kept developing wisdom and I matured, I turned my attention, and I got married, I turned my attention away from that endeavor to serving people. And so I recognized throughout my years, people weren't coming to me because of the interventions I offer. They were coming to me because of my presence and being. And I started to see that as gold, as material that we can use within ourselves to help heal other people and interact in a very authentic, very real way. And so here I am now a psychologist, 20 years later, still doing the same thing with people who are suffering. And so I want you for a moment to think about the people who have touched you in your lives. And I want you to think about in your mind your teachers and mentors that have influenced and impacted you. If you can just for a moment close your eyes, and for those in the audience, do the same thing too. In watching this video, think about the image of your teacher, your mentor. Allow any sensations to arise in the body as you think about these people. And think about their quality, the quality of being that your mentor or teachers embody. So if you wouldn't mind, a few from the audience, and I'll repeat it for the people watching, what are some of the qualities that the teachers you have been with embody? Fred?
Very supportive of you as an individual.
You feel supported as an individual, so that your teachers are supportive. Thank you. Valerie?
Compassion.
They embody compassion. What do you feel like when you're in their presence as they embody compassion?
Warmth, held.
You feel warmth and you feel held. Thank you.
I'm thinking of a visiting teacher when I was ill with rheumatic fever who treated me like I was an intelligent person that she could talk to rather than just a kid who needed to be taught.
So you felt like in the presence of this person, you were an intelligent person that was worthy of being talked to. Yes. Thank you. Anybody else? Some thoughts about what it's like to be in the presence of your teacher or a mentor?
They seem wise.
How do you know they seem wise?
I feel like they know things I don't know.
They know things that you don't know. What does that do for you?
Makes me feel more secure.
You feel safe and secure. Thank you. So these are some of the experiences of being in the presence of people we learn from. I have the joy of having one of my meditation teachers here in the audience, and I always feel a sense of warmth, and my heart tends to sing when I'm with her. And the truth is, sometimes she says things I don't even know what she's talking about. But the truth is, it doesn't matter. It doesn't matter. What matters is the warmth I'm feeling and the safety and the trust. I'm close with Richard Miller, who is iRest, founder of iRest, and I told him he could say cat, cat, cat. And I'll be like, yeah, and just get it. I just get that cat, you know? It doesn't even matter the meaning of cat. So for me, the presence is what heals me. I am healed simply by presence, not the content that comes out of the mouths of our teachers. And I believe that's the same in the clinical realm and with providers and with psychologists. And so presence, for me, I'm going to break this down. I'm going to operationalize what I think presence is, but it's really your job as researchers to do this. But I'm going to give you an idea what I think it is. I think presence is open, spacious awareness, warmth, and equanimity. This is, for me, what I think presence is. Open, spacious awareness, warmth, and equanimity. The quality of being able to bend in all situations without being broken, like bamboo. And so for me, when I'm with patients, I embody warmth, open, spacious awareness, and then equanimity. So nothing they says, nothing any of them say, bend me too far one place or the other place. And so for research, there's many ways that you can define presence and quantify it. You can measure this. You can measure the impact of presence versus non-presence on patients using measures of health, outcomes, physiological measures. There's all kinds of ways you can measure the impact of presence and having people who are not present. We have studies that look at physicians who score higher on mindfulness traits and compassion. Patients perceive the care as being greater than those physicians who are not present and not mindful and not compassionate, so much so that they return less frequently for care. And even if a physician doesn't give medication, the intervention of mindful awareness and attention and compassion has greater health outcomes than if you're just giving out medication. Because the perception of being cared for, all of the perceptions you gave here in the room, are embodied within the patient themselves. They leave feeling, I'm important, I'm seen, I'm understood, I've been cared for. That itself is medicine. So I'm asking you to consider presence as medicine also. So how do we study that? That's up to the new generation of researchers to think about. And what we'll take with your knowledge is then I can train physicians and providers, and all of us can train people in how to be present, how to use our presence as medicine in the field. And that leads me to vulnerability. Because within awareness, presence is awareness, and there's all these levels of awareness. So we have awareness of sensation, thought, breath, beliefs. We have awareness of awareness. And then we step back into the field itself, which holds all things. And when we're in that field, it's not a place where we can communicate from because the self drops away. So I'm not speaking about that field. I'm kind of coming into awareness of awareness. When I speak of presence, awareness, and vulnerability, that second awareness piece is really awareness of awareness. When we sit back and we notice all things arising and falling, but we are aware that we are aware. So that's another piece of awareness I'd like us to study moving forward, because in that realm is healing. Because we're not changing lenses in that in that sense. I'm not asking someone I'm sitting with to change the lens of cognition. I'm asking them to step outside and to witness all the lenses that they can use as they perceive the world. So that's that level of awareness I'm asking us to consider. But the last piece, vulnerability, I think is the most important from a human-to-human contact perspective. Vulnerability is that shared rawness, is the shared human experience with one another without shame of that experience. So vulnerability is our gift to people to say, I suffer too. I too know that thing that hurts you. Maybe the content is different. I've not been in combat, but my veterans know I suffer. I don't talk about myself in therapy. I use appropriate disclosures. But I share with them, I know suffering at a deep level. I know pain and I know darkness. I'm not afraid of this. I'm not afraid of sharing that with my patients because it makes me human and it gives us a sense of connection they don't have in other places. I'm also acting as a model for what it looks like to be vulnerable without shame. And what happens in vulnerability, it's like we all have our guards up. We all have our defenses up as human beings. And what does that mean? It means we don't show that we're afraid or scared or that we have low self-esteem, but it also means we can't let our light come forward because it's always dulled or blocked by the fears we carry of ourself in the world. So vulnerability allows some of our light to come through. It's a paradox. We think if we're vulnerable, we'll show our weaknesses. In fact, when we're vulnerable, we show our light. We show that we're human beings living an integrated experience. And we're no longer afraid of our pain and our darkness and our suffering because it makes us who we are. It's a part of who we are. So vulnerability is not weakness. It takes great courage to be vulnerable. And if we as providers demonstrate vulnerability, all of a sudden we have relationship. We have trust and safety in the room and attunement. And they see our light because we already see their light. We're doing this work because we know the light is in there. But if I'm vulnerable as a clinician, then they see it is not scary, in fact, and you don't need shame about who you are, and then the deep light of presence and being comes forward. So I'm asking us to consider as researchers, how do you study vulnerability within ourselves, and how do you study shared vulnerability so that we can measure the impact that vulnerability has on our patients. So I think in the end, I keep thinking about koans. In the Zen tradition, we get asked to blow our minds apart by answering a question that's unanswerable. The truth is, when you're presented with a koan, the answer comes with the question. But most people in their anxiety and excitement to be presented this challenge by a teacher don't really perceive what the teacher is doing when they give a koan, when they give a riddle to solve, an unsolvable riddle. The truth is, for me, the answer lies in the presence of the teacher giving the koan. And that teacher for us can be internal or can be external. If we're patients coming to a provider, the riddle of how do I solve my depression or my anxiety? How do I solve the deepest suffering in my life? I don't have answers. I have interventions that we use, but what I have is my presence. And so my hope is that as a provider, as a clinician, my presence is what's healing as I answer in whatever way I've been trained to answer. So that's what my charge is to future researchers in this field, is to measure that quality of presence within us that itself is healing. So I think I'll end there. I want to thank my meditation teachers, and I want to thank my wife because it was her presence that has been healing in my life. So that's really inspired this work that I'm doing. As having someone in my life whose simple presence is actually healing for me. So always have gratitude for her. And I think I'll end there and let you think about it and ask any questions. So thank you all very much. Thank you. Thank you. Charlie.
I think it's very easy for helping professionals to fall into a mindset that I'm a superior person helping patients and my personal characteristics don't matter. How could you get these people to loosen up and begin to realize their qualities matter and presence needs to be developed?
So the question is, how do we help providers and other healthcare professionals realize that who they are matters in the realm of service, in the realm of healthcare? Because sometimes they present as, I know these things and you're just the patient, so take what I'm saying. I think we have a lot of training to do. And the more we introduce mindfulness and meditation into our integrated healthcare system, the more self-reflection that's going to happen naturally, because that's what this practice does. It's a mirror in front of us. So the good news is, because of science, we're now allowed to teach meditation at the VA healthcare system. And what happens automatically and spontaneously is people are becoming more self-aware. I didn't even know I have these things in me. So, but I'm suggesting we go farther than that. We talk to them directly about the impact that they have on patients, and that if they embody presence, that alone could be a healing moderator, perhaps, in increasing health outcomes. Really direct conversations like we're having today about the impact that we have on our patients. Thank you. And Fred?
First, thank you for the talk. It really broadens our whole discussion. I'd like you to contrast or compare vulnerability and openness to experience.
The question was, can I compare and contrast open to experience and vulnerability? For me, vulnerability is the human piece where we admit to being afraid of things. So as a meditator, I can be in big open space and recognize, oh, there's anxiety. Oh, there's some fear, and I'm not moved around by it. But the truth is, most of us in our daily lives don't live in that realm. Some of us might, extended advanced meditators, have more access to that. Most human beings that I meet live in the fear mind, live in a very closed realm where their world is circulating around just thoughts and beliefs. Vulnerability on my part is admitting that I have those same things too, and that I understand the pain of living in that small realm of fear and discomfort. Vulnerability is also like, I've worked through that. I've been where you are, and I've worked through that. Here's some ways that I've been there by getting to open awareness, open acceptance of life as it is, because I can't have them jump from one to the other. It's just that feels invalidating to people who are coming to me saying, I'm suffering and I'm in this small space of, cramped space of suffering. And I can't just say, well, you're open aware, you're this big thing, because it's not where they're at. So vulnerability is the bridge for them to see, oh, you too, yes, how did you get out of that? Oh, let me tell you, let me get you there, let me be with you during that journey. So vulnerability is really the bridge to that open acceptance space. Thank you. Hi.
Something that's coming up for me is, and I don't know if this is specific to parts of the country or our just general Western American culture, there's a sense I have that a lot of people have this vulnerable state in their kind of private homes or with a few select people. But in our culture, we want to kind of present in a certain way where we're in control, we're well-behaved, we kind of follow the rules, and we do what's good for basically ourselves and everyone around us. And in a way, these practices are disruptive to that.
Mm-hmm.
And so my question for you is, how do we help kind of normalize this thing that is inherently disruptive to the fabric of society in a way that there will be some kind of growing pains?
Mm-hmm.
And as a clinician, is that a dangerous thing, to basically be encouraging someone into this space that might be temporarily disruptive?
What you're asking about is being vulnerable and present disruptive to the status quo.
Yeah.
Yeah, great. Next question? No, kidding. Totally. And so is TM asking all these people to sit and meditate together when it was not what the cultural state wanted them to do at the time. Yes, it shakes people up. On one hand, let's say when I worked in prison, I don't teach coping skills to be generous, kind, and loving and forgiving, because they're going back into the yard soon, and they can't have that attitude and keep safe at the same time. It's not adaptive. So we have to be mindful of what I'm teaching. Is it adaptive? Like, will it put people in vulnerable positions for their actual safety? So it's hard to teach a group of kids in juvenile detention how to change their lives and be open and receptive and kind and caring, and then go back into the environments where they're threatened all the time. We have to keep some hypervigilance going, because it's a safety. So in terms of that, I want to make sure very clearly I'm not advocating vulnerability in a sense that would be threatening to one's safety. But I am advocating that our system allow vulnerability and presence to come and be a vital part of it, because I do want to shake it up, because it can be very sterile and rigid to offer health care to people when they're being seen as a number. And so if we can train ourselves to be vulnerable as providers, then the system has to adapt to us. I'm asking the system to adapt to us, because I'm asking us to step up into a greater sphere of being. We'll see. Any other questions? And I think that might be it. That's time. Thank you all very much. All right.